Hi, my name is Dr. Lisa Peters. I'm a plastic surgeon, and today I want to talk with you about breast reduction surgery in young women and teens. First of all, to begin, breast reduction patients in general are some of the happiest people plastic surgeons take care of. And I find this to be particularly true in the age group of teens and women in their 20s. So in general, breast reduction surgery can be really life-changing for people. Not only does it make a significant improvement and sometimes cures back, neck, and shoulder pain, but it also can have quite a bit of mental benefit, of improvement in self-esteem, in confidence, and just generally the feeling of well-being. And again, I find that to be particularly true in young women. Though all women can have these improvements with the surgery. So why is it so helpful for young women? Well, being a young woman in today's day and age is hard. And young women, particularly who have quite large breasts, can have not only the back, neck, and shoulder pain that all women can have, but it can be particularly difficult for them in terms of looking heavier than they actually are, or finding it difficult to wear age-appropriate clothing that they can wear with the size of their breasts, or even worse, when they try to wear clothes that are age-appropriate, they can look provocative because those styles of clothing can't hide the large size of their breasts. And most of these women do not want to appear provocative. That can all affect a young woman's sense of well-being. So breast reduction surgery obviously makes a huge improvement in that. When we change a woman's proportions, we can make her body look more balanced. We can make it easier to find clothing that fits on the top and the bottom. And again, just generally have people have more confidence in the way they look. The other thing that's wonderful about breast reduction surgery in young women is that they find the surgery doesn't hurt that much. Now again, in general, breast reduction surgery doesn't hurt as much as most people expect it to. But my personal experience in that age group of the teens and early 20s, most of them tell me they have almost no pain with the surgery. Now again, this is surgery, of course there will be some pain, but many of those women take prescription pain medicine for a day or less as they recover from the surgery. In general, most women will take 1 to 2 weeks off of work or school as they recover from this procedure, but as the pain is less than most people expect it to be, so is the recovery. So most people are still feeling pretty good as they recover for that 1 to 2 weeks at home. So one of the main questions that I find I'm asked from young women is, what's going to happen when I have kids? And the truthful answer is, we don't know. But that's true in any woman, with or without surgery. So when a woman has children and breastfeeds or doesn't, women will find that their breasts change. Sometimes the breasts get bigger, sometimes the breasts get smaller, sometimes they get droopier. And that's true if you've had breast reduction surgery. That's also true if you've never had breast reduction surgery. The other thing is that any surgery on the breast could potentially interfere with the ability to breastfeed, and breast reduction surgery included. So when I'm seeing a young woman to talk about this operation, we really just need to discuss her priorities. If she says, I'm very uncomfortable now, I have back pain, neck pain, shoulder pain, I'm uncomfortable with my proportions or how I appear, or all these things we've already discussed, then she might decide that it's appropriate for her to have the surgery at this time. If that same woman says, I really look forward to having children someday and breastfeeding is something that's really important to me, then maybe that woman waits until she's done having kids. But the thing about it is that each woman needs to make that decision for herself. Many women who have had children or who have had breast reduction surgery are still able to breastfeed, but some are not. So if her priority is breastfeeding, she might decide to wait until after she's done having kids. But keep in mind, if I'm seeing somebody who's 20 years old to discuss this operation, it could be 10, 15, or 20 years before she's done having kids and breastfeeding. And that woman needs to ask herself, is it worth waiting that long to have the breast reduction surgery, to wait for that ideal time? In my personal experience, I find it to be very uncommon that a woman would redo breast reduction surgery after having kids, or need an implant because her breast got smaller, or have another lift because her breast got droopier. In general, yes, the woman's breasts will change with pregnancies and breastfeeding, but most of the time not to the degree that it bothers that woman enough to have additional surgery. One final comment, one big issue that many young women have that can be particularly troubling to them emotionally is breast asymmetry. So having one breast that's significantly bigger than the other. And again, this group of women in general are very happy to have had breast reduction surgery because they want a sense of normalcy. And by making the breasts more even, many of these women find themselves to look more normal after having had the surgery. That is not a judgment, that's the feedback that I get from patients. In general, I find that young women, when they come to see me, are pretty excited about the idea of having breast reduction surgery. They may have been thinking about it a long time. The moms are sometimes really nervous about it. Obviously, these are their kids, their babies. They're nervous for them from a safety perspective, from a, is she too young to consider this? Is this really the right thing to do? I feel like it's important, especially if a young woman has a mom who has those concerns. Bring mom with you on the day of your consultation. Let her learn about the surgery. I can explain the pros, the cons, the surgery, the recovery, the show before and after pictures. And I find that that really helps put moms at ease when their daughters are considering this operation. And it's not unheard of. I've had a number of times where it was the daughter who originally came to see me to discuss the surgery, but mom later also had a breast reduction because she decided it was also right for her. If you'd like more information about breast reduction surgery, I welcome you to visit our website. My website is plasticsurgeryofchicago.com. Again, my name is Dr. Lisa Peters. If you're in the Chicagoland area, or if you would like to travel here, feel free to call our office at 708-524-1400 to schedule a consultation and learn more about it in person so we can discuss what would be right for you. Thanks for listening.